Hi, my name is Dr. Bradford. I'm one of the veterinarians here at Bixby Animal Clinic, and today we're going to talk about canine parvovirus. We recently had a really sweet little 8-week-old shepherd puppy who was brought in. She was really weak, dehydrated. She was vomiting and having really severe diarrhea. She could barely stand. She couldn't keep down food. And so, of course, the first thing we think of when we see a young puppy like that is parvovirus. And we ran a quick test in-house. We were able to verify that she was parvovirus positive and kind of start coming up with a treatment plan. And parvovirus is really, really contagious and really, really dangerous, especially for young puppies. It makes them dehydrated. They can have secondary bacterial infections because the virus knocks out their white blood cells, and it can often be fatal without treatment. So thankfully for her, we were able to get her hospitalized on fluids. We have a great monoclonal antibody antiviral treatment that's pretty new that helps reduce the severity of the infection for these puppies. So she got that, and we were able to get her turned around with some intensive care and hospitalization. For about 2 days it took to really get her eating a little bit, looking brighter, and feeling well. But 4 days before we were able to discharge her from hospital. And then that also starts the time period from, recovery and when they're considered no longer infectious, because parvovirus is super, super contagious and it can exist in the environment for a long time if not properly disinfected. So she's gonna have to be pretty much isolated from other dogs for the next month while she's considered infectious. She will continue her vaccines after her recovery because those are what's most important in preventing parvovirus, as well as our other common diseases that puppies and dogs can get. So how you can protect your puppy from parvovirus: come in for your shots as scheduled and recommended by your vet. So typically every 3 weeks or so until they're 16 weeks of age, they need a distemper parvo parainfluenza virus combo vaccine. It's a really good vaccine. But in and of itself, it's not enough because puppies are still developing their own immunities. So you also have to keep your puppy inside or within your home, away from areas trafficked by other dogs that could be carrying diseases like parvovirus until they reach that 18-week mark when they're fully vaccinated and considered protected. So it's really important for all dog owners to get their dogs vaccinated and keep them up to date on the vaccine. Even adult dogs, though they're lower risk, if they're vaccinated, it'll reduce the spread of parvovirus and it'll protect puppies who are more vulnerable to the infection.